Good afternoon, teacher and classmates. The topic I'm going to talk about is hydroxyurea in children with sickle cell anemia. Definition: hydroxyurea is an effective treatment for sickle cell anemia, but few studies has been conducted in Africa, where the burden of disease is greatest. Conditions such as malnutrition and malaria can affect the possibility, safety, and benefit of hydroxyurea in low reserve settings.
Hydroxyurea is an effective treatment for sickle cell anemia that has been shown to reduce acute vaso-occlusive events and improve survival. Guidelines in the United States recommend hydroxyurea treatment for children with sickle cell anemia as early as 9 months of age. On a global scale, the incidence of sickle hemoglobinopathies is greatest in sub-Saharan Africa, but treatment studies in this region are limited. Because coexisting conditions such as malaria, other infectious diseases, and malnutrition may increase toxicity and limit effectiveness, the safety and efficacy of hydroxyurea in Africa is uncertain. In this Phase 1-2 open-label trial to assess the feasibility, safety, and benefit of hydroxyurea in young children with sickle cell anemia in 4 African countries, participants received hydroxyurea at a daily dose of 15 to 20 milligrams per kilogram for 6 months, followed by dose escalation. A total of 606 children completed screening and began receiving hydroxyurea. The study retention rate was 94% at 3 years of treatment. After 1 year of treatment, hydroxyurea therapy led to increases in both the hemoglobin and the fetal hemoglobin level. The increase in fetal hemoglobin, a known effect of hydroxyurea, dilutes the sickle hemoglobin and makes sickling less likely. The rates of clinical adverse events, including vaso-occlusive pain, infections, malaria, transfusions, and death, decreased from the pretreatment period with hydroxyurea use. 5% of the participants had dose-limiting hematologic toxic effects in the first 3 months of hydroxyurea treatment, which was below the expected rate of 20%. The authors conclude that hydroxyurea treatment was feasible, safe, and beneficial in children with sickle cell anemia in sub-Saharan Africa. Full trial results are available at nejm.org.
Application in nursing. People with sickle cell disease begin to show signs during the first year of life, usually at about 5 months of age. Identification of risks and possible source of infection. Verify that the patient uses make caps as long as possible. Teach and reinforce self-care measures in the patient.
What's your name? Tell me your name.
My name is Christiana.
This is Evan, and he has sickle cell.
I have the full disease SS, which is sickle cell disease.
And I had no idea what that meant. Blood disorder.
I have a port on my right side of my chest that they have to put the needle in it and get the blood transfusion.
We would see a number of children on average coming to the hospital 2 or 3 times a year, and they would have prolonged painful episodes. The requirements for transfusions would go up dramatically, and their quality of life would be greatly impaired.
Pros and cons.
This is Doug Brunk reporting from the annual meeting of the American Society of Hematology in San Diego. Mounting data from a federally funded follow-up study continue to demonstrate that hydroxyurea is a safe and effective treatment for young children with sickle cell disease. Dr. Zora Rogers presented the findings during a press briefing. Dr. Rogers, could you please highlight the key findings of this follow-up study?
Those children who were taking hydroxyurea had fewer admissions to the emergency room for painful crisis, fewer admissions overall to the hospital, less need for transfusion, as well as lower but not yet statistically significant differences in the number of admissions to the hospital for acute chest syndrome or painful crisis. So overall, what this study really shows is that if you continue to take hydroxyurea, whether or not you started it early in infancy or at 3 years of age, you continued to have a significant clinical benefit.
Pros. Hydroxyurea therapy is also beneficial for babies and children. Hydroxyurea can decrease the number of platelets in the blood. Washing your hands is one of the best ways to help prevent an infection. Vaccines can protect against harmful infections. Children with ACD should receive all routine childhood vacation plus some additional ones. And cons, damage to the organs of the body such as the liver, heart, and kidneys. Tissues or bones because no blood circulates to the affected areas. Hydroxyurea can affect fertility. Hydroxyurea causes congenital malformation if the moment of conception is taken or during pregnancy. Hydroxyurea increases the chance of your child getting an infection. Issue applied in Ecuador. The Ministry of Public Health must carry out neonatal screening for sickle cell anemia in the population and risk it in hospitals and public health centers or make agreements with accredited private institutions that use technology and training professionals.
My name is Calvin Lashrey Nunley. I'm 18 years old. I'm a Virgo. My favorite color is purple. My favorite food is tuna casserole and fish. My life goals are to become a nurse, make a nice income, get married, and have 2 or more kids. I stand 5 foot tall. I weigh 104 pounds. My hair color is brown. My eye color is brown. And I have sickle cell disease. What it was like for me the first time I experienced sickle pain, I was in the 5th grade and I really didn't know what was happening. All I knew is that my legs were going out on me and it felt like somebody was just stabbing me in my thighs, slicing my ankles. I couldn't even walk. It hurt so bad. I thought I was dying practically.
And conclusion, it is recommended to make the diagnosis of sickle cell anemia early, before the patient has complications that make it difficult and make their care more expensive, increasing morbidity and mortality, reducing the expectation and quality of life of the affected pediatric patients.
Sickle cell disease, also called sickle cell anemia or just sickle cell, is a genetic disease where red blood cells can take the shape of a crescent, or sickle, and that change allows them to more easily be destroyed, causing anemia, among other things. Sickle cell disease is caused by defective hemoglobin. which is the oxygen-carrying protein in red blood cells. Hemoglobin is actually made up of 4 peptide chains, each bound to a heme group. Different hemoglobins have different combinations of these chains. Hemoglobin A, or HbA, is made up of 2 alpha globin and 2 beta globin peptide chains. This is the primary hemoglobin affected in sickle cell. Specifically, the beta globin chains end up misshapen. This is because of a mutation in the beta globin gene, or HBB gene. Sickle cell is an autosomal recessive disease, so a mutation in both copies of the beta globin gene is needed to get the disease. If the person has just one copy of the mutation and one normal HBB gene, then they're a sickle cell carrier, also called sickle trait. Having sickle trait does not cause health problems unless the person is exposed to extreme conditions, like high altitude or dehydration, where some sickle cell disease-like symptoms can crop up. What it does do is decrease the severity of infection by Plasmodium falciparum malaria. So in parts of the world with a high malaria burden, like Africa and pockets of southern Asia, those with sickle trait actually have an evolutionary advantage. This phenomenon is called heterozygote advantage, and its unfortunate consequence is a high rate of sickle cell disease in people from these parts of the world.
Thank you very much for your attention, guys.